slotted in to the prior auth departments where insurers do the rejections or they accept a medical, call by a doctor. But we don't allow this. We've effectively banned it. We've made there no incentives to do it.
So just so I'm understanding, because I want to make sure I'm understanding exactly what you're saying. If we send $1, if we spend $1 on health care, 85% of that has to go to the actual treatments, meaning that the providers are only allowed to take 15% of. Okay, yeah.
No. Anything
really
not
quick,
administrative.
30 seconds, then we're going to welcome back radio for our last segment. So 30 seconds here.
Sounds good.
No, yeah, go for it.
Anything not administrative. So that 15% is whatever's left over. And what that means is that in order to meet that level, like at the end of a billing cycle, what they'll do is they'll just pay more for stuff. So if a doctor says like, I want to bill blah, 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 they can bill blah, blah, blah. They'll pay more for medication. They'll overpay for all sorts of things. They'll get wrong claims and just pay them because they have to meet this legal requirement. In order to manage like this fact, they transfer large portions of their medical claim revenue to their PBMs, their subsidiaries that aren't regulated directly by this regulation.
All right, we're going to welcome back radio to continue with Kramer. Fascinating conversation. We'll be right back. All right, welcome back. So, Kramer, it sounds like there's you said that these two buckets, they essentially lead to 90% of the problems with the ACA. If you were consulting President Trump, JD Vance, would you just say deal with this 85% ratio issue? And it sounds like one other, I forget what the other one is. No, okay.
So these issues are unfortunately statutory. So statutory means that Congress is the reason for the issue. Congress has, in the case of the MLR, the medical loss ratio requirement that drives so much of the spending issues and so much of the lack of AI-related innovation in healthcare, the issue was Congress gave the HHS the opportunity to write up the rules. And they gave them some limits. And it said you have to write the rules a certain way, and these rules are terrible. But in order to reform it, you can't just have the HHS rewrite the rules because of those limits put in place by Congress. If you actually wanted to fix this issue, you would have to very likely, unless you can get some Democrats to agree, and I really doubt you could, you would very likely have to suspend the filibuster, which is something that the Republicans should be doing right now, and then go and get Congress to change it. So were I to offer this advice to Trump, I would say push on the filibuster, keep pushing, pushing, pushing. You have to get them to change the thing because you can't do it directly. But as president, you will be blamed for any sort of healthcare mishaps or just continuations of bad trends that we've had going on.
That is the big tough question. We've talked about the filibuster a lot on this show, and because Trump wanted to get rid of it to end the shutdown, and we've generally said end the shutdown, but only, or end the filibuster, but only if you have a home run slate of legislation to pass. Otherwise, you're just going to do some lame thing and then fart around, and then Democrats will have no filibuster to do their agenda, which is a lot to cut on what they want to do.
It's a lot scarier too, by the way. And so there are two, like there's popular aspects of ACA, right? Is the uninsurable people, right? That you couldn't have some very expensive treatment that you need for the rest of your life.
The pre-existing condition thing. People like being on their parents' insurance.
And then being on your parents' insurance. Would your recommendation, just from a political standpoint, put your political hat on, would you say, let's keep those things in place and fix these underlying, I guess, statutory issues? I mean, you could instead of replacing Obamacare, you pitch it as like, hey, these reforms would make it better.
Yes, I absolutely would. So the big thing is, with respect to the pre-existing condition requirement, it does add a lot of costs. I mean, it obviously does because you have suddenly people who are high cost being covered and you're in the same pool as them and you got to cover them. So that's a big issue. But if you fix the medical loss ratio requirement and you allow healthcare providers, if you allow health insurers to make better use of their prior authorization departments, you can minimize the downside of those people because you can offer them more tailored care. You can offer them, you can say, hey, your doctor called for this, but we actually think there's a better option here. You can figure out what is more optimal to give them in terms of care and save a lot of that money that you would have wasted anyway. But you're forced to spend it, so it doesn't matter. At the moment, it becomes a bad thing in large part because there are no incentives to fix the issue from a technological perspective. Like you can't go the technological route and minimize the issue the other way, which we totally could do if we fix this other issue. So I think keep that in place. It's fine because it's so popular. No one wants to touch it, and you really do still want these people to be covered somehow. Like it's a humane issue. At the end of the day, you want them to be covered in some way. That isn't just like.
So one last question I'm thinking. Yeah. So you mentioned it's statutory issues on the biggest things, but what is the best thing you think the Trump administration could do right now, just with its regulatory executive branch authority? Doesn't need Congress, which is its own big problem. What could they do tomorrow if they wanted to?
They could fix tons of the issues with CMS. So like that site neutrality thing I mentioned before, it is totally able to be fixed. The issue is the enforcement there. They have that power to fix that issue and enforce it. And they've written up those rules, and they have changed those rules, and they have not enforced it. That is the big issue, is enforcement. And there are tons of things like this. So they could get away with fixing a lot by just enforcing the rules and change. There are some things they can change too. So they could be adventurous. There are some untested legal theories here, like Section 804 is the thing that allows states to sign up to start importing drugs for their Medicare, Medicaid programs from Canada at Canadian prices. If they were to be a little adventurous with this, they could expand that by changing two parts of the regulation so that states could import Canadian generics that don't yet have a generic equivalent in the US, thus lowering prescription drug prices a lot. It's totally on the table to do a lot of little fixes that are in untested legal territory, if they want to try that, and they could meaningfully lower the cost of healthcare, considerably beyond what they've done so far with the negotiations. Because the negotiations, they've actually been getting kind of duped on. Like a lot of the Trump RX stuff that they've done, where they've tried to directly go to Pfizer and tell them, give us most favored nation rates. That stuff doesn't really work to cut prices very much. Yeah. Unfortunately, you think there's a lot of room there, but the issue is.
Sorry, we're running out of time. Should we go? Can we go over?
Sure, we'll go a few minutes over.
Let's go a few minutes over. Oh, I just love having this guy on.
Yeah, all right. We'll be right back for Stream Radio. Got to say goodbye. Real America's Voice. We'll see you tomorrow.